rheumatologistoncall.com.
Welcome. Mary and I would like to welcome Dr. Diana Girnita to our discussion on integrative medicine and how it can be used in the fields of dermatology and rheumatology. Dr. Girnita is board certified in rheumatology and internal medicine and is licensed in multiple states, which we'll be talking about. She is the founder of Rheumatologist OnCall, which is an innovative direct specialty care platform. She's authored numerous publications and has also received additional training in nutrition science and mindfulness, which is really fantastic. So welcome, Diana, and thanks for being here with us. We're really looking forward to our discussion with you.
Thank you so much. I feel very honored to be invited by my colleagues, dermatologists, and have a discussion about lifestyle medicine and integrative medicine.
Fantastic. Well, the three of us know that there's a huge overlap between dermatology and rheumatology, and I think a lot of our patients also know that. Many people, our viewers who have psoriasis, will also have psoriatic arthritis, and they're looking for integrative solutions or nutrition or lifestyle modifications that they can make for their joint disease. So what general advice would you give somebody in that situation?
So those patients that already started to look into integrative medicine, patients with psoriasis or psoriatic arthritis, I want to congratulate them for taking the path, because that's the most important thing, to understand that your skin disease or your joints disease is not one single problem. It's a small problem that you see from a big problem that you don't see. So it's like the tip of the iceberg. And when you try to address it in a more integrative way, your chances for success, thinking about the outcome of the disease, but success of response to your treatment will be significantly different from someone that will not look into that kind of approach. And I know patients are ahead of the game, because I have many patients that they reach out to me with psoriatic arthritis, that they are interested not only in the traditional medication path, which, many times it's a valuable solution for patients, but also to enhance the response to treatment, they approach it in a more integrative way.
Oh, that's great. Do you find that in rheumatology there are specific diseases like psoriatic arthritis or rheumatoid arthritis that are more responsive to these treatments, or that there's just more data about these treatments?
So we have a lot of scientific data about the role of nutrition in patients with rheumatoid arthritis, but we also have data in patients with autoimmune diseases like psoriasis. And not only about nutrition, there is significant data about exercise or about mindfulness and the role of those other options for patients to integrate to have better outcomes of their disease.
Oh, that's great. Is there a specific, so if I'm a patient and I come to you and I say I have, rheumatoid arthritis or psoriatic arthritis, I want to get better faster, so I'm happy with traditional medicine, Western medicine, but I also want to incorporate some of these alternatives. Is it patient specific, the advice you give, or is there sort of an overarching generalization that you start with these patients?
So you have to start with a general approach, and then you tailor it to the patient needs. I mean, we can have general principles that we can share with patients, but every single patient is different. Their needs are different. So I always sit down with the patient and understand what exactly are they doing in terms of their nutrition, in terms of their sleep, in terms of how they manage their stress, or what is their level of stress, or what is bringing the stress in their life, and how much they can exercise, what they can do when they begin a program, like an exercise program, and then I tailor it to the patient needs.
Yeah, I mean, that sounds really comprehensive, and that's probably not the mainstream approach. Is that a correct statement?
Yes, it's not.
I mean, Mary and I no longer see patients, but even when we did, patients were asking about sort of these approaches. And so I think it's becoming more popular, but certainly under the main model that we have, there's no time to sort of address these things. And that's something that Mary's brought up a lot, in our frustration in doing that. So you have sort of figured out a way to address that. Mary, do you want to touch base on that?
Yeah, so we were interested in learning more from you, how you can tell our audience of patients how you are addressing this potential gap in treatment, and the fact that at least when patients would try to see me, I was so backed up, it would take months for them to get in to see me. And I'm wondering how Rheumatologist OnCall is able to counteract that backlog.
So it's very important to understand why the patients are coming to us. Many times patients are referred to us and they don't necessarily need to be seen by us. So many of their problems or questions could be answered at the primary care level, but because of lack of time, primary care levels, they also direct patients right and left because they don't have that time to address all the needs of the patient. And as you know, in the traditional practice, a new patient, if he gets 15 minutes in a new patient evaluation, he should be thrilled. But what can you do in 15 minutes? You can address one problem or, basically one problem of the patients. But patients, when they come to us, they do not come with one problem on their, table. They come with multiple problems, and all these problems are connected. So there is a huge need to give time to the patient, and the traditional system does not support that in our days. So I stepped out of the traditional system and I created my own environment where I see patients for 1 hour, and sometimes I take more time to review their chart. There are very complicated patients from time to time that I just sit down, I allocate time to go through the chart of the patient, and I don't scroll through the chart while I'm seeing the patient, and I'm trying to type while I'm seeing the patient, and then I ask questions hurry up to type more. So I think it's very important to understand the problem of the patient, but give time to the patient. Now, how you solve that, it's also a big problem because we are not enough specialists. And those of us who are specialists in one field, we are very limited by, our employer that doesn't allow us to see patients from other systems, or the insurances that you get contracted, or the license that you carry, because if you carry only one license, you can see patients from that area, or you cannot see patients from another state, or just the nearby state. Many physicians, they just have a license for one state.
Yeah.
And this is very, very sad because patients that they need us, they don't live only in the metropolitan areas. They live in, out in the country, and they don't have access. That's the problem. Or they have to travel hundreds of miles. So what I have implemented, I do have a practice, a local practice where I see patients, but I also have a telemedicine practice. And Rheumatologist OnCall was based on that, to offer patients a telemedicine solution to access a specialist when they need it the most. Now, I don't contract with any insurance because insurances will limit the patient's access to me by creating these in networks, but will also limit the patient to come to me. Okay, so. Yeah. And I'm making everything very, very open, and I've done that from the very, very first day. When I opened the practice, I posted the prices so patients could see exactly the cost of the care, to be transparent. I don't play the game. I don't charge co-payments and then I send surprise bills. I don't do that. So I'm offering a service that is very transparent, it's very affordable, and it offers the patient access when it's needed, not like, in 3 months or 6 months or a year from now.
And is that how you also structure billing in your local practice as well?
Yes, the billing is basically set up in 2 ways. There are patients that just need a consultation, 1 or 2 visits to sort out if that problem is pertinent to my specialty, or they might have, they might have to sort out if they have rheumatoid arthritis or osteoarthritis. And if they have osteoarthritis, I don't keep them. I educate them. I educate the primary care physician, and I move the patient back to the primary care physician. I do not keep it in my practice unnecessarily. So for those patients, they just pay for what they need. But for patients that they need to remain under our care, then they have a membership model, which basically gives them access to all the advantages that I just mentioned. And patients understand, they know what to expect. There is no surprise. So when they need us, they have the access. When they need labs, we can offer transparent prices, but they can also use their insurance. If they want to use the insurance, if it's more valuable for them, or if it's more cost efficient for them to use the insurance, they can use the insurance to pay for their labs or imaging or medication. Mm-hmm. We also offer that as a benefit of being members of the practice.
Yeah, your website, it's excellent because it is transparent. And I think that's one of the frustrations that both patients and physicians feel, meaning even us as providers, when you're in the insurance model, if a patient asks me how much this biopsy is going to cost me, I couldn't tell them, and I should be able to tell them, but I'd have to go ask the manager because it depended on so many different factors. So I think that the transparency is refreshing. And you can handle labs and x-rays and things like that, you just send a digital order?
Yeah.
Okay.
Yes, we do send whatever the patient, we have different ways of working, but let's say a patient wants to do an x-ray in an area. All I need is the zip code of the patient, and I work with a company which will find me the best price for that x-ray or for that imaging study in the zip code of the patient or nearby that zip code. But if the patient finds a better price, I will always welcome that. I just send or fax the order to whatever the patient wants, and they have the price that they want in the area that they live.
Yeah, that makes a lot of sense. And that really is patient-centric, right? Because you're really focusing on what is better for them, financially, which is helpful. So.
I mean, we as physicians, most of the time we are blamed by the cost of our care. But as you said, when we are in our training, and then when we are in our, employer positions, we have absolutely no control on the costs of our care, and we are not aware about any prices that are managed or sent to the patients. We are completely blinded from knowing that. And when you try to ask, or when you try to find out, when the patient will ask, you will be told, they will tell you that's not your business. Your business is to, see the patient code and bill better, okay? But you as physicians, we as physicians, we feel responsible. We are the interface of the system with the patient, and the patient do not have a relationship with our manager. They have a relationship with us. They build trust in us, and they build a relationship with us. So they will expect us to be financially responsible and not become a burden for them. We are not a burden for them, but they do not know that. Unfortunately, right. The media stream and, somehow these messages get to patients that we physicians are responsible for the cost of healthcare. And I always tell patients when they ask me that from that huge amount of money spent in healthcare every year, like trillions of dollars, our salaries are between 6 and 7%. So patients will be shocked when they hear that, because this kind of data is not easily found by patients.
Yeah, that's such a good point. And I'm glad that you shared that little bit of information for our listeners to learn this. And another question I had, when you said you put in a zip code and to try and find them the best price for whatever ancillary testing you want them to have done, do they also have the ability to get this testing done through their insurance, even though you are ordering it outside of insurance?
Yes, they can choose based on their based on their advantages. So let's say someone has an insurance with high deductible, $8,000.
Yeah.
Usually an MRI, if you go through your insurance, it's going to be billed $7,000. So that patient will be responsible to pay $7,000 until they meet the deductible. But if you go through my practice, or through a cash facility, or if you offer, that's the thing that patients do not know, they should offer to pay cash, then you're going to find out that the same MRI is between $500 and $600 or $700. It depends on the zip code where they live in. So what are you going to choose, 7,000 or 600? And then you can use your health spending account to pay for that $600 and avoid to pay $6,000. So we have to educate patients, but unfortunately the physicians that now are practicing in the traditional model, they have absolutely no idea that patients can have these options. So I feel very responsible, and I always tell patients, these are your options. And patients love that because, when they know where their money go, they feel responsible and they feel good that they make the decision, because there is no one that will spend your money better than you, right?
Exactly.
You will know your needs, you will know your expectations, and if you want to pay for something, then you expect that quality service, but you also know the cost, and you appreciate the cost, and you appreciate transparency, and you make that decision. And I can tell you that all the patients that I have interacted with in this direct specialty care model are very responsible patients.
Yeah, I agree.
Go ahead, Mary.
I was going to say, I found that same trait in these patients. They're,
motivated.
That are seeking out this alternative. Yeah, they're motivated and appreciate transparency for sure. I wanted to briefly just touch on a similar story that I experienced that you did as well. You wrote about a 44-year-old male patient who had severe rheumatoid arthritis, and he was able to find remission in his disease after adopting Mediterranean diet. And I briefly told you about a similar adult female patient that I had who had really, truly one of the most severe cases of an inflammatory scalp disease known as lichen planopilaris. I mean, her erythema was so red it was purple, and she was definitely losing large amounts of hair in her frontoparietal scalp region. And I put her on everything. I threw everything at her. Intralesional steroids, systemic steroids, methotrexate, Plaquenil. I was running out of options after we were chasing this for a year. And she came into me one day completely clear and with full hair regrowth. And I was completely shocked. And she was kind enough to teach me in that moment that she actually sought out a dietitian who put her on an anti-inflammatory diet. And I was excited to learn this. I was so happy that I felt privileged to have been shown these truly amazing results, that I wanted to share them with my patients. But under the traditional model of our healthcare delivery, I not only was finding no time during my visits with patients to be the one to provide them with that instruction. So instead, I was just simply referring them to the same dietitian who was local to my practice. And some patients were averse to going because of not only the time commitment, but the expense. So then I would also, I referred them to a book that I read myself, written by a functional medicine physician. And it was my introduction into this whole space of lifestyle medicine. And so in those patients who, offer your platform, whereas most dermatologists don't offer that platform. So what advice can you give any patient out there who's seeking this kind of advice and guidance, but whose physician that they prefer to remain getting their traditional care from doesn't have this platform nor the time? Like, what resources can you refer them to?
Yes, I can talk a lot about my experience with patients. I think that patients are extremely valuable in our education, medical education. If you listen to patients, you're going to learn a lot, because they don't only have the experience with you, but they do have experience with other people, and they do read and they do research different topics much more than probably we have the time to do. And I had to learn myself from a patient, like you did, about the power of nutrition. I mean, I grew up in a country where I knew that there are certain principles, and I grew up with a Mediterranean diet without even knowing that I'm eating a Mediterranean diet.
Yeah, that's the best way.
I had no idea that I'm eating a Mediterranean diet. And then, when a patient of mine came to me and said, look, I want to embrace this Mediterranean diet, I was like, okay, that's fun. I was like, I come from a background where I invested a lot in my education, medical education. I did a PhD in immunology. I did research from Harvard to Pittsburgh to Cincinnati. I did tons of research. I published this and that. But I never thought that nutrition will make such a huge impact, because first of all, we are not educated during medical school, during residency, during your first years of being an attending. I think you learn the most. I think that's at the time when you really learn reality, and you match reality with what you know or what you learn, or you try to fit those things. But I started to read about it, and I said, okay, so he was telling me about Mediterranean diet and mindfulness, and how mindfulness saved his marriage and saved his his job and all of that. And then he told me that he feels so much better and he had no more flare-ups. He was coming to see me for rheumatoid arthritis just because we had this fascinating talks where I was listening and he was talking, and he was a mathematician. Okay, so he was very well educated gentleman. And then that's how I was introduced to nutrition. I went home and I started to research on PubMed. What is the connection between this and rheumatoid arthritis, and mindfulness and rheumatoid arthritis, and mindfulness and psoriasis or psoriatic arthritis? And I was blown away by how much I was able to find. And then I said to myself, okay, but this is so much. I don't know if it's good, if it's bad. So I took an extra training myself. I went to do, nutrition science courses at Stanford, and then I did mindfulness training at University of Massachusetts, because I wanted to understand, from the best places that I was able to find at that point, what is going on? How is this possible to be so helpful for patients? So that's how I learned about nutrition, gut health. I had no idea about the gut, the importance of gut, the relationship between gut and immune system. I had no idea. And then I learned about exercise and mindfulness and supplements. And over the years, I started to put some, pieces together, kind of create a protocol for patients. Like you said, general approach. And then I was taking that and applying to the patient needs. So over the years, I created what I called, for patients with rheumatoid arthritis, because they were the most patients interested in this approach, and I had a huge number of patients with rheumatoid arthritis. I started to create, I call it rheumatoid arthritis healing formula, because patients, when they hear about certain things, they are more receptive to start a program. So because in time, I started to get a lot of patients that will ask me just about that. They didn't want to become my patients because they had their local rheumatologist, but they also told me, my rheumatologist never speaks to me about that, but I like them. I want to stay there, or I want to remain in that network, or I want to have access to him in person, but I need your program. So that's how I come up with this idea to put the program in an online course. And I structured the course to be in 4 easy steps for the patients. 1 step, and it's all scientific based. So I'm not selling anything, as take this and you're going to be cured. I'm not doing that. So just to be clear, and I'm telling all the patients, when I give you this program, you have to be committed. This is not a program that you try for a week or 2 weeks or a month. In a month, you're going to see clear results. Every single patient, they tell me that they have less pain, less flare-ups, they have less brain fog, and then they see that the program helps them with decreasing the amount of medication that they take. So all these changes are coming, but you have to be persistent, consistent. So just to briefly give you an overview, I have the first stage, or the first step, is to detox, eliminate certain things that are very toxic for patient's body. I'm give you 2 examples: salt, too much salt, and too much sugar.
Mm-hmm.
And it's horrible for patients to remove sugar. I'm telling you, it's like you take them from, I would say cocaine or something like that.
It's a legitimate withdrawal. It's a legitimate withdrawal.
Yes.
Yeah.
And patients will tell me, this is horrible. So the detox is the first step. And then I tell them about how to heal. And I tell them, and I make the connection with their gut and the gut inflammation. So I introduce there why is needed to eat more fibers, what are probiotics, what are prebiotics. But I don't sell them supplements. I tell them what are the foods to incorporate. I give them recipes. And then I move them into the next step, which is the supercharge, where you basically educate patients what are those anti-inflammatory foods. And I tell them about legumes, enzymatic fruits, all the leafy greens, spices. They have no idea how important the spices are. And then in the last phase of this program, which is also scientifically based. So once again, science is my, go friend. I will not give anybody any advice, just anecdotal advice. So in that boost phase, I tell them about supplements because they are interested about that. And I tell them about fish oil, vitamin D, turmeric, and there are others which are proven to help. But if you don't structure it in this way and you just dump the whole information on the patient, they will not do anything. They will be confused. They will be overwhelmed.
Yeah.
They will be lost. They will research on Google. They will find people that will sell them different stuff with the promise that they're gonna cure them.
Mm-hmm.
Please don't do that. Please don't believe people that are not specialists in autoimmunity. I see these days on social media, and I'm sorry to say that, but I have to say it. Patients are trickled, or patients are fooled by people that say, "Oh, I'm an autoimmune disease expert because I have that disease, and I believe in this, and I did that, and it works for you." You have to be very careful because you have to choose things that are appropriate for you. And some people are gluten sensitive, but many people are not. Mm-hmm. So there is no point for you to remove gluten if it doesn't, help you. Or it doesn't make any sense for you to be in a very restrictive diet and basically avoid many, many things if you basically gonna benefit from those things. So patients should be very, very careful about what they choose and who they choose to treat them.
It's so refreshing to hear you say this and sort of your philosophy behind it, because I think that's the mission that Mary and I share.
Yes.
And we, like you, were surprised when we started looking into this. There actually is quite a lot of data out there, and it's something that I think our medical colleagues aren't aware of and don't have the the time to look into. Certainly not with their current schedules. But giving accurate information is a challenge because there's a lot of misinformation out there. So I applaud your model, and I think that that's one that Mary and I are looking to do as well, to provide accurate information. And we also always have to remember, and we know this as doctors who have seen individual patients, that it is individualized. So what works for one person is not necessarily going to work 100% for the next person. So you have to be very careful sort of about promising that. Do you find that there's resistance at all in the rheumatology community with sort of this aspect of medical care?
Like you said, the lack of education is paired by the lack of time. Physicians do not have time to invest in this kind of program, and you have to invest your own money too.
Yeah.
I mean, to go through a program like that is expensive. I mean, I pay a lot of money to go through this program, but I wanted to educate myself before I'm able to educate others. And the community, the rheumatologist community, started to be more open. And I have to share something with you, which I found fascinating. This year, the American Congress of Rheumatology, I was invited there as a speaker, and I was attending different, sessions. For the first time, since I know this Congress, and I've been to this Congress probably every year for, many, many years, for the first time, they had a session dedicated to food in autoimmune diseases and the importance of food in treating autoimmune diseases. And they invited two authors of some studies about the Mediterranean diet from Italy, of course. And those doctors, they were unbelievable. They talk about diet and the role of Mediterranean diet for at least 10 years. But only now they were invited here to speak about, and they had a whole session about food. And it was so refreshing for many of us to see that we finally acknowledge the role of food as medicine. We talk about that, but we didn't implement that.
Yeah, on the flip side of that is also patients need to understand the role of food in disease. Because, as you know, our highly processed foods and refined sugar products are without a doubt a trigger of so much chronic inflammatory disease.
Okay. Yes, that's true.
And Maria, did you have another?
I think, do you have any other experiences you want to share with us about patient sort of success stories with this approach?
There are many patients that are basically surprised to hear a physician starting the conversation. Because most of the patients, when they come to me, they come for evaluation for an autoimmune disease. And once I kind of clear that, then I go to the next step and I say, there are some things, that you can do, and not only will help your disease, your autoimmune disease, but will help your overall health. And I also make the comment that, if you are trying to treat one tree from a forest that is sick, you cannot expect the whole forest to flourish and to be, green and vibrant if you don't treat the whole forest. Because when we look at the current medical treatments, we are more and more focused on the targeted therapy. And just by treating one molecule, it doesn't mean that you can treat the whole body. And there are more and more physicians that they do realize that, especially in our world, the specialists. We are so focused to treat, I'm focused to treat the joints, and the dermatologists want to treat the skin, and the orthopedics want to treat, do surgery. And, every single specialist that I know, they try not to cross the boundaries. They try to stay in their area of expertise and not bother others. But I think patients should be looked as a whole. And if you ask me about stories, I have also a story of one patient. She came to me for back pain. She was in her 30s. She had severe back pain, classic features of inflammatory back pain. I did a whole evaluation on her, and she had clear signs of inflammation. Clear signs of inflammation on the MRI. But when I talked to her, she said to me, I want to make a family. I want to have babies. Everything that you propose in terms of treatment, will impair my options at this point. And I'm 32 years old and I want to live longer and live healthier. And I want to do something different than the traditional medicine. So I started to talk to her about this formula, and I went with her through the steps. And she came back to me in a month. She felt so much better. And then in 3 months, she said, I have no more pain. And I was like, great. And then I said to her, in 6 months, let's repeat the MRI. I repeated the MRI and she had no more signs of inflammation. And I was like blown away.
Wow. So you have radiographic evidence that
Yes,
6 months later.
Yes, I had that. I always look at the things, with caution. And her markers of inflammation trended down and then they became normal. And she told me every single time when I go outside and I eat outside and I drink some, sodas and I eat a few cookies, 3-4 days after I feel miserable. And then I start to feel better because I come back to my own regimen and I come back to what I do and things quiet down. And that was not only one time. I've seen this lady for about 5 years. And she comes back for follow-ups every 6 months, but every single time she's telling me the same story. And she does not have any more pain, which is unbelievable. I mean, this is for a physician to see that kind of evidence, radiographically evident, and blood work trending down, markers of inflammation trending down and coming back to normal. This is real proof that, lifestyle medicine works.
Yeah, and it's reinforcing to her. I mean, as you said earlier, it's hard for people to follow some of these steps just because it's not sort of our quote unquote natural way of doing things in this country. But when they recognize the correlation between sort of what they're doing and their joint pain or how they feel, I think that makes it so much easier for them to continue, which is, I mean, that's the best way. That's amazing.
It's how you present to patient, how you work with the patient to achieve those goals. I talk to my patients even about the SMART goals, okay? And I try to give them very clear instructions with, and they choose their goals, okay? They choose what they want to achieve and the time that they want to achieve. But then I am accountable to follow on that, and they are accountable to me to implement those changes. But when they have support, they will do things. When they are on their own, they will do it for a week, 2 weeks, and then they will, life comes in the way, and then you forget about things, and then you come back to the same problems, actually.
Yeah, 6 months later, you're exactly where you started, so.
Sure.
Oh, that's great. So people can find you at rheumatologist.oncall.com. That's the website, correct?
Yeah, that's the website. That's my website, rheumatologist.oncall.com.
And do you know what states you're licensed in off the top of your head?
Yes, I do. I'm licensed in California, in Texas, Arizona, Ohio, Indiana, Kentucky, Montana, Florida.
That's great.
And I think I'm missing one. But, on the website, we try to keep updated the states where I'm licensed. And the goal is to expand in other states and help many other patients because, unfortunately, if you don't live in the metropolitan area, you have to travel. I had patients that will have to travel 3 hours to see me, and this is unreasonable for a consultation or for follow-up.
Right.
Yeah.
It's not fair to the patient because, and the other thing that I've seen this year at the American Congress of Rheumatology, they were talking about the role of telemedicine, which again was not heard before in managing chronic conditions. We all know that it can be done, but it wasn't accepted by the fact that they couldn't bill for telemedicine.
Exactly. That was the problem. Well, this has been a great chat, Mary. Any other questions?
No, I really enjoyed speaking with you today and learning your great success. And
you're inspiring to us, for sure.
A trailblazer, inspiring, and we hope to model our future endeavors after your great success.
Thank you very, very much for inviting me. And thank you for putting together your efforts to build up a practice like that. There is so much need for collaboration between us, we as rheumatologists. There are more and more direct specialty care rheumatologists. I'm, very proud that, not only that I inspire them, but I help them to put together their practices. And we do have an alliance. It's called Direct Specialty Care Alliance. If people wants to start learning about the direct specialty care model, there is the place to go. And we build up a map for patients to be able to find us, and for other doctors. If I need a rheumatologist, or if I need a dermatologist or another specialty that will offer this kind of integrative approach with specialty on top of that, then you know where to find it. Because 3 years ago, when I started, I had no idea if there are other specialists. And over the last 3 years, I have educated, I have given lectures, I have been invited to talk about the model, because it's so much need, not only for patients, for physicians as well. Unfortunately, last year, there were 117,000 physicians that left medicine because of the drama that is going on in healthcare. So not only patients are suffering, physicians want to practice medicine, but they just have to have the guidance and the mental ability to know that they can do it. So DSC Alliance is the website, dscalliance.org.
dscalliance.org. Okay, great.
Yeah, that's the website, and there are tons of information there. We put there, information about how to build up a practice, and we have built a course for physicians to come in and take the course. There is also a YouTube channel where I have invited people that created direct specialty care practices to share their experience, and to share from their experience to give to other physicians. So the YouTube channel is called Direct Specialty Care Alliance. So, and it's all for the benefit of patients, of course.
That's fantastic. Congratulations on all of this. That's really, really phenomenal. So thank you for all of that. We will spread the word. Certainly, I think a lot of dermatologists will be interested in that.
There are more dermatologists that are coming into direct specialty care.
Good. Great. Well, thanks again for being here with us. We will definitely be in touch, and I hope that our roads definitely cross sometime in the future.
I hope so. Have a wonderful day, and thank you very much for inviting me.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Rheumatologist OnCall.com